New videos every day.
One of the keys here is all about energy. You know, the concept of energy, right? Generally speaking, you know, if you've got energy, you're going to tend to be relatively happy with your life. If you've got a pretty good energy available and you take off and you're driving your car and you have a flat tire, well, you're not happy about having a flat tire, but you stop and it take 10 or 15 minutes, you change it and you're on your way. And maybe even you have a chat with somebody walking down the road while you're changing your tire and it actually turns into a happy moment. On the other hand, if you're already exhausted and depleted and then you have a flat tire, it's like it's a total thing that'll send you over the edge into suicide, right? So, energy. So what can we do about energy? Let's just talk for a few minutes about energy as a key to helping with depression, right? Physically, what do we do to help with energy? Sleep, rest, good nutrition, wholesome foods, you know, protein supplements or other things that boost energy, superfoods, you know, other nutritional substances, omega-3 fatty acids, minerals and vitamins if we're deficient in that. But basically wholesome eating, rest and sleep, together with the one thing that has been shown in various research studies over the years when compared with antidepressants directly to be at least as effective or more effective, and it's exercise. It's real simple. If you're not getting exercise in your life, add that in as a so-called treatment for depression, and generally speaking, you'll get good results. I mean, if you're already kind of chronic fatigue syndrome and very low energy, then obviously you need to go very gentle about this. But generally speaking, getting that half hour, 3, 4, 5, 6 days a week of good exercise is going to really make a difference. So that's some things on a physical level, as well as the fact that there are legitimate medical conditions, right, that can cause depression. Blood sugar, hypoglycemia kind of dynamics. You know, so again, obviously that's related to nutrition, but it's also related to, you know, conditions like diabetes and things like that that need to be remedied, right? Thyroid. That's just a couple of problems that can be very directly related to depression that it makes sense to diagnose. Emotionally, what about emotion? Depression is basically a shutting down of energy and specifically emotional expression, right? Grief is not depression. Crying is not depression. We get very confused about that, and psychiatry certainly does a lot of times, interpreting the expression of emotion, which is actually a release of distress, as a symptom of mental illness. Now that's way wrong. If you're crying a lot, that's not a pathology. The tears are the healing. You're dealing with something that's processing out, and allow the tears and accept, and eventually that will transform. Depression is generally a shutting down. So talking about what's going on, getting support for it, going into your grief, going into your sadness, going into and expressing your anger, whatever it is, getting that emotional energy flowing. Give and take. Talking and receiving. You know, getting some counseling can help in this case. So this emotional dynamic is also social, obviously, you know, but just to emphasize that in and of itself, the social realm, you know, if you're in a situation or your loved one's in a situation where they've created an isolation dynamic, you know, where they've cut off from relationship and not really involved in community, it would make sense to help with that, to address that. You know, this has been demonstrated, well, this is just a fact of human nature that we're social, that we do better when we're in community and we're relational. That's a basic human need that when not met leads to unhappiness. And so finding people to connect with, even if it's called just being in a group with other depressed people to start with. I mean, ideally you want to be with people that are a little bit uplifting you. But basically, create a social dynamic, even if it's just going to a professional counselor to start with, to start talking, to get some support, to get some empathy, to get some affinity going. That's a real key. It's been shown with old people, with young people, with any age. If connection is broken, and by this I mean connection to other people, then unhappiness results. So reestablishing connection is probably maybe the most important thing I'm saying right now. Mentally, right? In modern day mental health system, which as my friend Mike says is better called the mental illness system, in the modern day psychiatric system anyway, you have drugs as the one treatment for depression. The other one that you do hear some is called cognitive therapy for depression. And that's the one thing that you'll tend to be offered sometimes. Well, that's not a bad thing. All it means really is that you're looking at your thought patterns. And if you have kind of self-defeating and negative thoughts like I'm a jerk, or a little something goes wrong and it's all my fault, or it's the end of the world because my bicycle broke down, then you can actually gently challenge your thoughts and start replacing some of those with a little more positive possibility, even if it's just called, things could possibly one day get a little bit better, as a beginning dynamic. That will help. So that's looking at the thought patterns. Okay, one more domain real quick, spiritually, and I've already talked about this, so this is back to the beginning about becoming an individual, becoming spiritually mature. That means finding out who you are and what your purpose in life is. One famous person in the history of psychology is a guy named Viktor Frankl. He wrote a book called Man's Search for Meaning based on his experience in a concentration camp. But he's arguing that one of the main needs that human beings have is purpose in life, and that with the loss of purpose and meaning is a loss of joy and happiness in living, and strength to live, and vitality to live. And so, call it rekindling purpose, call it whatever you want, but there is an aspect of looking at, what is the meaning and purpose of life. And this is why it's also necessary to kind of allow the time for so-called depression, because that answer cannot be given to you by somebody else. My father wanting me to be a doctor is not my meaning and purpose. My meaning and purpose is what I was born with based on my gifts and what I have to offer to the community. So supporting somebody to take some time to allow that. And if you've been in the public education system for 20 years and you've been living somebody else's dream for 20 more years, then it may take a little while to sort that out, but it can be done. It might mean meditating, it might mean praying, it might mean taking time for contemplation, but you can definitely do it. One last thing, my personal number one antidote for depression is to walk in the woods or along the river or the creek. I find that if I expand my relationship beyond the human world, call it the more than human world, call it the world of animals, wind, water, spirit, trees, flow of life, I'm a lot happier.